All right. Hello, everyone. Thank you for joining us. Another episode of Tattoos and Telehealth. My name is Nicole Baldwin, a board certified nurse practitioner. This is my good friend and colleague, Kelly White, and she's also a board certified nurse practitioner and she specializes in functional medicine. So, today, we wanted to talk to you about repurposed medications. But before we get started, just be mindful this does not constitute a patient-provider relationship, and this is not medical advice. Just two girls just chatting about medicine. So, Kelly, if you want to start off, tell us. Let's talk about repurposed meds. What does that even mean?
So, repurposed medications just means that when we take a look at a prescription medication and we think about what else it can be used for. So, like let's say, let's pick on metformin for instance. Okay, everybody knows what metformin is. It's a very common medication, typically used to treat diabetics. Well, metformin also does a lot of other things on the cellular level. And so, whenever a company starts to test their medication to get it ready for public use, to get it ready to present to the FDA to say, this is what we would like to use it for, it goes through trials. And when it goes through trials, it has to figure out all the other little things that it does. And when it does that, the great thing about it is it also lets us write down the other things that it can do. So maybe it doesn't just treat diabetes. Maybe it also blocks cellular pathways for this particular disorder, or maybe it disrupts these pathways for this disorder. And so when we find a drug that treats other stuff, we allow it to be repurposed and used to treat other disorders. So it's like saying, I'm going to take ibuprofen because I have a headache. Well, it helps with my headache, but it also decreases inflammation in my joints and it also can thin my blood and so it can do other things. And in doing so, we call it repurposed. And the great thing about functional medicine is I get to share that knowledge with my patients and let them explore the world of repurposed medications and learning that they can take these medications in different doses at different times to treat different things. And it's fantastic because we've learned that in doing so, we have a wealth of knowledge in these medications by using them in different ways. We don't always have to use a medication for that particular thing just because that's what it says it was for. We get to repurpose it and use it for other things.
So let's talk about really quick. Let's talk about Viagra.
Ooh, yeah,
That
tell us.
started out right as a cardiac med. It
Yep.
vasodilates, right? It vasodilates, and so that's what that started out as. Now, through the clinical trials, obviously it came out for ED and less of a cardiac. But some of these medications, like what we're talking about today, is the medications that they come out for something and they're for something for a very long time, like the ibuprofen or like for whatever. And then we find out years later, because things are researched constantly, hey, this is also good for, like metformin, this is also good for, right? And so some of these medications, they're out of patent. So they are super, super cheap when you're comparing it to like current treatments that are, new drugs and new types of medications to treat certain disorders. And, you know, just even like Wellbutrin, it treats anxiety, it treats depression, and now we know it treats mild ADHD as well, right?
Hmm.
And it's not this expensive ADHD, which most ADHD medications are pretty expensive. It's very cheap. And it's that the patent has run out. It's been out for 100 years or whatever. And now we can use it for other things, right? And so these repurposed medications is definitely getting some traction, I think, especially in the functional medicine world, as you specifically were talking about.
I like the old school parasitics. Like remember going on mission trips and you had to take mebendazole whenever you came back to make sure you didn't have worms whenever you got back home.
Yeah,
Mebendazole is an old drug and the patent's been out on that one for I don't know, ever, I think.
yeah.
And there is a ton of research on mebendazole and all the things that it can do for your body. It's a great drug. But in a very different dose, it's used for a lot of different things, and it's just amazing. I think especially in functional medicine, gut health, you guys have heard me say it if you've been listening to our podcast, gut health, gut health. But the way that it functions to do other things and the tremendous impact that it has on your immune system and your gut health is just amazing. But there are just so many other things that you can repurpose a medication to use. I think that it's important to bring that to light. I think it's important for the public at large to understand that you don't have to take this particular drug because it says it treats XYZ and that's your ailment. Do some homework, take a look around, find you a good functional medicine provider, nutritionist, somebody in your area that specializes in repurposed medications. You may find a much less expensive alternative to what you are trying to treat.
Yeah, just like you were saying, we used to have to take after the mission trips, we would take mebendazole. Now we prescribe doxycycline to take while you're gone to
Yeah.
prevent certain things, or ivermectin while you're gone to prevent certain things, like the different parasites and things like that. But it's there's definitely some areas out there where it's definitely gaining some traction. So awesome news, awesome news. All
I love it.
right.
All right, guys, check out Repurposed Medications. Take a quick listen to our podcast and then go do your homework, guys, and bring us the questions you have.
All right. Have a good day. See you next week.